You're concerned about rheumatoid arthritis, but your lab testing comes back negative. What should you do? Hello, this is Dr. Siddharth Damber, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. Common question that I hear in clinic, but also on social media, is they have concerns that they have rheumatoid arthritis. Their primary doctor checked some labs, the antibodies came back negative, and they've been told they don't have rheumatoid arthritis, and they're not sure what to do next. So let's talk about this. First and foremost, big picture, understand that there are a lot of different reasons why a person can have pain. Inflammatory arthritis and rheumatoid arthritis is one of them, but there are other types of inflammatory arthritis conditions. There's also degenerative arthritis, tendinitis, hormone-related issues, nerve-related issues. There's really quite a few different other things that can cause pain. So make sure you're being evaluated for all that, not just narrowed in a little bit too much where you're not thinking about the big picture about what else could be causing your symptoms. With that said, understand that rheumatoid arthritis has very specific clinical criteria. That includes your symptoms, what areas are affected, if there's signs of inflammation, if there's any imaging testing, and if there's lab testing. Also understand that at initial presentation, when symptoms first start, 50% of patients will be negative for rheumatoid factor and CCP antibody, which are the most commonly checked antibodies for rheumatoid arthritis. And long-term, for people living with RA, 25% of them will be negative for those antibodies as well. So the antibodies are a part of the picture and the diagnostic criteria. They are not in isolation 100% of how we make this diagnosis, though. The biggest key is that you need to have some objective findings that are consistent with active inflammation in a disease presentation pattern that is consistent with rheumatoid arthritis. So what do I mean by that? Number one, your symptoms need to be inflammatory in nature. That means you should be complaining of pain and swelling in the joints, very significant stiffness in the morning, pains that are worse first thing in the morning and generally better with activity. Those are generally inflammatory symptoms. And for RA, generally you're thinking about someone who's had symptoms for more than 6 weeks. So it's not just a short one-time issue, it's a chronic issue. Next, on your examination, classically there'll be some findings of inflammation, which can include swollen joints, tender joints, when your physician is examining you. And the last part of it is also imaging. Classically, it's X-ray imaging, but that generally shows more chronic damage issues. A more sensitive set of tests would be either diagnostic musculoskeletal ultrasound or MRI. What's nice about those two imaging modalities is that sometimes on examination, there may not be clear-cut signs of inflammation, but on imaging, let's say ultrasound done in the clinic, there may be subtle signs of inflammation or fluid in the joint that could be consistent with developing rheumatoid arthritis or early RA. So in short, what do you do if your lab testing is negative and you're concerned about rheumatoid arthritis? Number one, make sure your physician is thinking globally about what else could be causing your pain so they're not missing out on what is driving your symptoms. And again, understand that your physician should be looking for those other objective findings of inflammation and not just focused on the antibody testing. Hope that was helpful. If it was, please like and subscribe. Until we connect again, have a good day and live well. Bye-bye.